more than 4,000 nurses are desperately needed to help prevent a breakdown of healthcare services in the midst of the pandemic's fourth wave. For more on Canada's nursing shortage, our Chase team has reached Tim Guest in Barrie, Ontario. He is president of Canadian Nurses Association. Great to have you on the program, Tim. So Quebec will be making this announcement soon on how it's going to deal with its nursing shortage. We're all waiting for that. Help me to understand, how deep does this shortage go across our country?
Well, Suhana, thank you for the opportunity to speak with you. You know, nursing shortages, they're not a new reality for us. They're something that we've been dealing with for many, many years. Our current situation, while it is worse than what we envisioned because of the pandemic, we did foresee it. And we believe that the issue is in part a result of inadequate planning due to having inadequate workforce data. We believe that there needs to be a national approach to this so that we can come out of this with a much better workforce strategy that looks at it from a federal, like a cross-country perspective, and not do it province by province, territory by territory.
Because that can lead to its own set of issues, right? Each province doing its own thing, trying to do the best for its healthcare staff. So what is your organization suggesting? I mean, if you had to pick three things that need to be done in order to retain and recruit nurses, what would it be?
So one, certainly, we've said it a number of times, there needs to be some designated funding by governments to come together and support tailored, sustainable, accessible, and long-term mental health supports for nurses to keep them in the workforce. One of the things that we've seen in the pandemic, due to unmanageable workloads, extended shifts, canceled vacations, and moral distress that they've seen, these have added to burnout and significant numbers of individuals reconsidering whether they want to continue with nursing as a career choice. We need to do something to support those individuals to keep them in the workforce. That's one that we need to do. We believe that it's important for employers and governments to look at incentives to encourage recruitment and retention. They both have to happen side by side. We just can't focus on recruitment. And nurses need to be involved in some of those discussions to determine what are the elements that are meaningful and will make a difference with recruitment and retention of nurses.
Is it usually money? Is it usually that you pay people enough, they'll do what you want them to do?
No, it's not only money. I think it's supports to education. As an example, we have seen that we have a distribution issue with significant gaps in supply in rural and remote locations. Long-term care is an example, and we're seeing it more in critical care. If nurses had access to funds to access education and professional supports to be able to work in those areas, they may choose to go there to help with some of that gap. And another one that's a really significant one, we saw something quite unique in the pandemic, and it has impacted the practical experience of nursing students. And I think we're going to need to spend some significant effort to help them transition into the workforce, any of the students. And we transition to practice is a big issue that we've been talking about for quite a number of years. We see stats of 35 to 65% of new graduates leaving the profession within 2 years if we don't support them properly.
And are they applying to nursing schools, or is that tap even drying up?
No, that's one of the things that's been really exciting is that we've seen an increase in applications. Many nursing programs across the country have seen an increase in applications. They're having more people apply that they can take in, which is good. I think one of the other things that we need to focus on, and that is having designated programs and funding supports to encourage Black, Indigenous, and people of color into the nursing profession because they're grossly underrepresented.
Yep. Tim, on a personal note, how have you been doing through all of this, through this pandemic, through keeping people motivated, trying to get your thoughts across, getting changes made through government?
It's what I chose to run for this role, and I knew what was coming with it. The pandemic certainly wasn't what I planned for, but while I've had very difficult conversations with my colleagues when they've told me their experiences, I can say that I've never been more proud to be their colleague and to be a registered nurse at this time.
I want to thank you for your time, Tim, and be well. Tim Guest is in Barrie, Ontario. He is president of the Canadian Nurses Association.